Hello and thank you for tuning in. This is my fourth recording on the topic of vitamin B12 in pregnancy and childhood. In the previous presentations, I shared with you data that indicated a very low vitamin B12 concentration in the serum of pregnant vegetarian women. That low serum concentration translated into low level of maternal milk. And I also shared with you that there is a chance that when children are breastfed and they don't receive adequate amount of vitamin B12, they may develop a variety of health problems. In fact, in my last presentation, I shared with you data on specific children that developed a variety of hematological, neurological, and developmental problems related to the deficiency of this particular vitamin. By now, many women have heard that inadequate folic acid intake during pregnancy may result in neurotube defects in their children. Unfortunately, few women have heard that vitamin B12 deficiency could potentially cause the same issues. In fact, sadly, I have to say that few health professionals, and that includes few dietitians and other nutrition professionals, have heard of this connection between vitamin B12 deficiency and neurotube defects. Yet, as it is illustrated by this review study published in the American Journal of Clinical Nutrition in 2009, vitamin B12 and neurotube defects, the Canadian experience, study after study showed that low serum vitamin B12 or low vitamin B12 status is associated with higher risk for developing these conditions. I would like to assure you that this is not just exclusive of Canada. The results are applicable worldwide. What we have here on this slide is on the left. In the left column, we have several studies listed, illustrated by names of the first authors of these studies. Under a heading study, we can see Kirk and Molly and some others, other studies listed here. On the right-hand side, in the last column, we have a risk of developing neurotube defects among women with the lowest vitamin B12 status in comparison to the highest vitamin B12 status. Let me point out that just with one exception, the second study by Molly, this is the outlier, this is the exception. All of the other studies showed higher risk of developing neurotube defects, again among women with the lowest vitamin B12 status in comparison to those with the highest. In fact, that risk ranged from 1.8 times higher, that means 80% higher, to more than 13 times higher, which means more than 1200% higher. Just as a reminder, neurotube defects include conditions such as spina bifida, which is illustrated on the lower left side of the screen here. Spina bifida literally means an opening in the spine. In the upper corner on the left side, we see the same condition, or very similar condition, but the opening is in the head rather than in the spine of this particular baby. But there are other conditions. For example, here on the right-hand side, we see an illustration of a condition we called anencephaly, which literally means without the brain. And yes, children are born without the brain, and this is a result of, for example, inadequate folic acid or inadequate intake and status of vitamin B12. Of course, these children cannot live without the brain, and so they die within a few minutes after birth. Other conditions classified as neurotube defects include things such as hydrocephaly, which means water in the brain, macrocephaly, which means large head size, microcephaly, which means small head size, and others. I would like to quote from this manuscript. These data also suggested that the population attributable risk percentage for neurotube defects in the presence of low vitamin B12 status was as much as 35%. Neurotube defects are affected by several conditions. I listed or mentioned already folic acid, and I just introduced you to vitamin B12, but there are others, for example, obesity or alcohol or the use of certain drugs. What this quote is saying is that low vitamin B12 status accounted for as much as 35% of that risk. So out of all the different risk factors that we can list, 35% of the risk was attributable to vitamin B12 status. Vitamin B12 deficiency is also associated with another condition known as hypospadias. Here is a study published in the British Journal of Urology International in the year 2000. A maternal vegetarian diet in pregnancy is associated with hypospadias. Here's a quote: "Mothers who were vegetarian in pregnancy had an adjusted odds ratio of 4.99. That means 5 times as high risk in comparison to those to other mothers." This quote will further explain. Of giving birth to a boy with hypospadias compared with omnivores who did not supplement their diet with iron. So in comparison again to omnivores, which means non-vegetarians, the vegetarian mothers had 5 times as high risk of developing hypospadias. Hypospadias is a condition of an opening of the urethra in the penis. Urethra is the tube that connects the penis with the bladder. And this is an illustration of a normal opening on the tip of the penis. And these two illustrations show hypospadias. The opening is in the lower portion instead of in the tip of the penis. It wasn't until 2009, at least to my knowledge, that developing this condition was connected with low vitamin B12 status. This is a study published in the Journal of Urology. Quote: "Among women who took supplements, reduced hypospadias risk was associated with higher dietary intake of choline, methionine, and vitamin B12. The respective odds ratios for the highest versus lowest quartiles were 0.7, 0.6, and 0.7. What these numbers mean is that in comparison to those with the lowest level of vitamin B12, those with the highest had 30% lower chances of developing hypospadias. I should rephrase that. Women with the highest level of vitamin B12, had lower chances of having a baby born with this particular condition. 30% lower chances, those with the highest in comparison to those with the lowest intake. Interestingly, we read further in the manuscript, among women who did not take supplements, increased risk of hypospadias was associated with higher vitamin B12 intake. The odds ratio for the highest versus lowest quartile was 3.1. What this part of the quote is saying that women who ingested the highest intake of vitamin B12 from foods, they were not taking supplements. So those who were taking vitamin B12 from foods, had those with the highest intake had about 3 times higher risk in comparison to those who were ingesting vitamin B12 from foods in the lowest amount. So what we find is very interesting here is that when vitamin B12 was provided from supplements, there was a 30% lower risk of developing hypospadias in the children. But when they were consuming vitamin B12 from foods, those with the highest intake had 3 times higher risk in comparison to those with the lowest intake. This perhaps explained or was sort of a proxy for foods from which vitamin B12 was ingested. Vitamin B12 is found only in meats and products of animal origin. We will have to wait for other studies, new studies, that will explain, hopefully, these interesting findings in here. But we can already say or conclude that vitamin B12 deficiency causes congenital health defects. For more life-saving information, I would like to refer you to my newest book, Vegan Vegetarian Mother and Her Baby. You can contact me at romucha@hotmail.com for information how to obtain a copy.